Hello, my name is Jen. I am going to be your nurse today. Welcome to the Urgent Care Center. How are you?
I'm okay.
Okay, what brings you here?
I hurt my ankle the other day.
Oh, I'm sorry to hear that. How, you said the other day, so did it happen yesterday or?
2 days ago.
2 days ago. And which ankle is it?
It's my right ankle.
Okay, tell me about it. What happened?
I was in the yard playing with the kids and I accidentally stepped into a small hole and fell awkwardly. And I heard a crunching sound and it was instantly painful.
Okay.
And yeah.
Okay. Well, how about the pain right now? On a scale of 0 to 10, with 0 being no pain and 10 being the worst pain you can imagine, what pain level are you at right
Just
now?
sitting here, probably a 3.
Okay.
If I try to put pressure on this or move around a lot, 7 to 10.
Okay. And what pain was it when it first happened?
It was 8 or 9 probably.
Okay. Does it seem like it's gotten better over the last 2 days?
Not really.
Okay. Have you been able to do anything that makes it feel better, even temporarily?
I've tried to elevate it, ice it, and take ibuprofen.
Okay. And are you taking just the over-the-counter ibuprofen?
Yeah.
Okay. So those are 200 milligrams. How many tablets do you take at a time?
2 or 3, and 3 or 4 times a day.
Okay. Great. So when was the last time you took ibuprofen?
About 3 hours ago.
Okay. Wonderful. So does anything seem like it makes it worse? You said that putting weight on it?
Putting weight on it.
Okay. Have you noticed anything else? Are you having any bruising or swelling?
No bruising, a little bit of swelling.
Okay. Are you able to wiggle your toes?
Yeah, not very comfortably though.
Okay. It hurts when you wiggle your toes?
Definitely.
And how about, are you able to move your ankle?
I can move it, but it's very uncomfortable.
But it hurts. And does that increase the pain when you do
Definitely.
that? Okay.
Yeah.
Well, it sounds like you're going to need to see the doctor. So just to get things started, I'm going to do a health history, and I need to ask you some questions if that's okay.
Yeah.
All right. So can you tell me your name and date of birth?
Joe Chesbro, January 14th, 1975.
Awesome. And do you identify with a certain gender?
Male.
Okay. And do you identify with a certain race or ethnicity?
White.
Okay. Where were you born, Mr. Chesbro?
Only in New York.
Great. And what do you have? Are you employed at this time?
Yeah,
Yeah?
I teach.
Oh, great. Where do you teach?
Rockport.
Wonderful. At the high school or the college?
College.
The college. Okay. And do you like that?
Love it.
Oh, good. May I ask if you're married?
I'm married. I'm happily married.
Well, that's great. She's a lucky girl. Let's see. I need to ask you some background information. So some of it's going to be about your childhood. Do you think that your childhood immunizations are up to date?
Yeah.
Okay. And have you had any of the adult immunizations? Do you get flu shots?
Yeah, most times.
Okay.
Most years.
And how about, have you ever had the hepatitis A or the hepatitis B shots?
No.
No, okay. So the HPV shot only works until the age of 29, and it wasn't available probably when you were 29. So do you think that you've gotten that HPV shot?
No.
No, okay. When was the last time you had a tetanus shot?
Probably about 4 years ago.
Okay, awesome. Do you, so that seems like it's up to date because that's good for 10 years. Have you ever been hospitalized for anything?
Yes.
What were you hospitalized for?
Appendicitis. Most of this when I was young.
Okay.
Kid. Like pneumonia, appendicitis, had tubes out of my ears, or
Okay.
in and out of my ears.
Okay. How old were you when you had appendicitis?
I was in 2nd grade.
And did you have to have surgery?
No.
Do you think it was just treated with antibiotics then, maybe?
I don't remember what they gave me, but it passed.
Okay. And have you had any problems with it since?
Nope.
Okay. And do you remember how old you were when you had pneumonia?
I was probably about 5,
Okay.
6.
And do you remember much about it? Were you in the hospital for very long?
Yeah, at least 2 weeks.
Wow. Okay. Have you had any problems with your lungs since?
No.
No. Okay. And you said you had tubes in your ears
Yeah.
in and out. Do you think that might have been for chronic infections? Do you know what it was for?
Yeah, and the infections.
Okay.
Yeah.
Well, how old were you the last time that you had tubes in your ears?
They got taken out, I think, in high school.
And do you think it was like the end of high school or the beginning
Like
of high
10th
school?
grade.
About 10th grade?
Yeah.
Do you remember how old you were when they first got put in?
Probably around 3rd grade.
Okay. And do you still have a lot of ear infections?
No.
No? Did you? So it seems like the tubes may have helped?
Yeah.
Okay, great. Have you ever had any serious accidents, like car accidents, broken bones, anything
No.
like that? Okay. Any health concerns that you have right now? Anything that's ongoing?
No, not really.
No? Okay. Let's see. And you said, have you had any operations? Any surgery?
Just
or
the
anything?
tubes.
Just the tubes. Okay,
Yeah.
great.
Tonsils out.
Okay. Well, how old were you when you had your tonsils out?
Like 5.
Okay. And were there any problems from that?
No.
Okay. So, do you have a primary care physician
Yeah.
or a provider? And who is that?
Dr. Devosic.
Okay, great. When was the last time you had a physical?
About 3 weeks ago.
Okay, and were there any concerns that were brought up?
No.
No. Okay. Do you have any health issues that you take medication for?
High blood pressure.
Okay. And do you have any health issues that you don't take medication for?
No.
Okay. Do you remember what the name of the medication is that you take for your blood pressure?
I think it's called Zestril.
Zestril?
Yeah.
And do you remember about how many milligrams you take?
I think they upped it to 20 a few years ago.
So 20 milligrams just once a day?
Yes.
Okay. And do you take anybody else's prescription medication? Sometimes people share their medicines? No. Do you use any herbs or supplements?
No.
Okay. How about do you
actually elderberry?
Elderberry?
If I'm getting sick, yeah.
Okay, and do you do elderberry tablets or syrup?
Tablets.
Okay.
Works great.
And so you use that just when you're getting sick?
Yes.
Okay, great. Do you ever use any alcohol?
Occasionally, not a lot.
Any tobacco?
No.
No. And do you ever vape or use
no.
Juuls, anything like that? Okay. Do you ever use any drugs like marijuana, heroin, cocaine?
No.
No, nothing like that. And tell me a little bit about the alcohol. Do you drink beer? Do you drink wine? Do you drink liquor?
Wine, or hard seltzer water a few days a week.
Okay. How much do you drink at a time?
Just like one can,
Okay.
one bottle, or no, one glass of wine, not one bottle.
Okay. Okay, so one glass of wine.
Yeah.
So one glass of wine
Yeah.
or one hard seltzer.
Yeah.
Okay.
Like, yeah.
And 3 or 4 times a week.
Yeah.
Okay. Has anyone ever suggested to you that maybe you drink too much or anything like that? Have you ever had problems with alcohol?
No.
Okay. Do you have a dentist that you see?
Yeah.
Yeah. And how often do you get your teeth checked?
Twice a year.
Okay. Any concerns when you see the dentist? Okay.
No.
How about, has your physician done any screening tests? Have you ever had a colonoscopy?
No.
No. Have you ever had a blood work drawn called a PSA that checks for prostate cancer?
No.
No. Have you ever had a PPD done for tuberculosis?
Yes.
Yes. How long ago was that?
It's probably 8 to 10 years ago.
Okay. Do you remember if it was negative? If it looked like you
It was
didn't
negative.
have anything? There was no follow-up testing needed?
Right.
Okay, great. And are you allergic to any food?
Not that I know of.
Okay. Are you allergic to any medicines?
Not that I know of.
Great. Are you allergic to anything in the environment?
Like dust and pollen and that kind of stuff.
What happens when you're around dust and pollen?
Just aggravated symptoms.
Okay.
A runny nose, watery eyes, that type of thing.
Okay. Do you ever take any medicine for it?
No.
Okay. Great. I need to ask you a little bit about your family history, so I hope you don't mind that I'm asking these questions. May I ask, is your mom still alive?
Yep.
Yeah? And does she have any health concerns? Anything she takes medicines for? Or any lasting issues?
I'm not aware
Okay.
of what she, like, any medication she takes.
Okay. How about your dad? Is he still alive?
No.
Can I ask how old he was when he passed away?
He was 36.
Okay, I'm sorry that happened.
Yeah.
Do you know if he had any health concerns?
I don't think so.
Okay. How about your mom's dad?
He died of a heart attack at a pretty young age.
Okay. Do you think he was less than 50?
Yeah, I'm almost positive he was.
Okay.
Yeah.
And how about your mom's mother?
She's passed on, but she was older. It was more natural causes kind of thing.
Okay. How about your dad's parents? Did your dad's mom pass away?
Yeah,
Yeah,
same kind of thing,
sorry.
natural causes.
Okay. And how about your dad's dad?
He had a heart attack in his mid-60s.
Okay. I'm sorry to hear that.
Mm-hmm.
Do you have any siblings?
Nope.
No? Okay. We need to talk a little bit about just your general body, just
Okay.
if you have any concerns. When you think about your skin or your hair, have you had any trouble with wounds, openings, anything like hair loss, any hair dryness, anything like that?
No.
No? Okay. And any trouble with your head, like any headaches, any injuries to your head, anything like that?
No.
Okay. How are your eyes? Have you gotten your eyes checked recently? Or in
It's
the
been a
past?
year. I'm due.
Okay.
Yeah.
Were there any concerns about your eyes?
Just normal, like, needing glasses, that kind of thing.
Oh, okay.
But nothing beyond that.
Do you normally wear glasses?
For
Contacts?
for reading close up.
Okay, so just for near vision then, just for the reading.
Yeah, mostly. Yeah.
Okay. And but never had any injuries to your eyes, no discharge, nothing like that.
No.
How about your ears? Do you feel like your hearing is okay? Do you ever have trouble following a conversation?
I'm pretty good there.
Okay. Wonderful. And how about any trouble with the outside of your ears? Any itching, drainage, anything like that?
No.
No ringing in your ears?
No.
Okay. How about when you think about your sinuses and your nose, do you ever get sinus infections? Do you have a lot of stuffy noses?
Occasionally with the
Okay.
sinus infections, but nothing that would bring me in.
Okay. How about sore throats? Do you have any like throat issues or sores in your mouth?
Nothing, sore throat occasionally
Okay.
again, but nothing regularly.
Okay, so no real concerns there
No.
except just occasional things.
Yeah.
Okay. How about when you think about your chest or your underarms, any concerns? Do you do self-breast exams?
No.
Okay, so that's something that maybe we can talk about.
Okay.
But do you ever have any muscle tightness or chest pain, any excessive sweating, any lumps or bumps under your arms, anything like that?
None of it.
Okay. How about your lungs? Any trouble with shortness of breath or coughing?
No.
Ever cough up blood or anything?
No.
No, okay. And how about your heart? Do you ever have palpitations? I know you said you have high blood pressure, but do you ever get chest pain or had any heart issues?
Nope.
Okay. When you think about your hands or your feet, do you have any trouble with swelling or cold hands or feet?
No.
No, okay. How about your stomach? Any trouble with diarrhea, constipation? Do you feel like you're pretty regular
Yeah.
when you go to the bathroom?
Yeah.
What color is your urine usually?
Yellow.
Okay, so no concerns there, no burning or irritation or anything when you go to the bathroom,
No.
when you urinate. Okay. How about your muscles and your bones? Any history of broken bones or muscle strains, anything like that?
No.
Any trouble moving any of your joints or your extremities?
Other than my ankle, no.
Okay. How about your nervous system? Any trouble with seizures or twitches or muscle contractions that you're not expecting, anything like that?
No.
Okay. Any mental health issues like anxiety, depression?
No.
No. Have you ever had trouble with like bipolar disorder or schizophrenia?
No.
No. Any trouble with any kind of addictions or anything else that you're worried about as far
No.
as moods or anything like that? Okay. Wonderful. Now, when we think about your endocrine system, we think about diabetes, thyroid issues. Have you had any problems with anything like that?
No issues with that.
Okay, wonderful. So, when you think about how you're feeling about yourself, do you feel like you have a good feelings about yourself, or do you feel like you're kind
You
of
mean like self-esteem?
yeah? How's
Yeah.
your self-esteem?
It's fine.
Okay, great. And are you a pretty active guy? How would you describe your activity level?
I try to be active. I try to do things several days a week. And,
Okay.
You know,
What
do my
kind? How do
best.
you exercise?
A lot of times I'll exercise at home. Just do interval training at home. Sometimes I'll do trail runs.
Okay, wonderful. And so we really need to get that ankle better for you. That must be interfering with a lot of stuff that you want to do.
It blows.
I'm so sorry. How much sleep do you get a night?
It varies. I guess probably averages 7 hours.
Okay, great. Would you and in general, do you follow any special diets? Do you follow like a gluten-free diet?
I try to be lower carb.
Okay.
Maybe not extreme, but you know.
And do you feel like you get a pretty good balanced diet?
I think I do okay.
Okay. Would you consider yourself a spiritual person?
Not really.
Okay. What do you turn to when you're dealing with stress?
Exercise, music.
Okay, wonderful. Do you think that you're exposed to any environmental hazards as far as like noise pollution, maybe poisons in the air, asbestos, any kind of toxicity, anything like that?
Not that I know of.
Anything at work that you're exposed to that you're worried about?
No.
Any of those things? Okay. Are you concerned at all about any threats of violence or harm between you and your partner or anybody at home?
No.
Do you feel safe in your home?
As long as the rest of this interview goes well, yes.
Okay.
Sorry.
Overall, what's your perception of your health? Do you feel like you're pretty healthy, or do you have some health concerns?
Getting older, but doing okay.
Okay.
Yeah.
Well, Mr. Chesbro, thank you so much for answering all my questions. I will have the doctor come in, and this is just going to help speed everything up. So thanks so much.
Yeah.
I hope your ankle feels better.
Thank you.
Okay.